false hope and destroying lives. Jill Newlands runs a makeshift clinic under her home, offering an alternative treatment for cancer sufferers. But the critics say it's quackery.
I think she's putting people's lives at risk.
Off you go.
Well, have you anything to say to Maria? Maria is at this stage
See ya.
lying dangerously ill with blood clots.
See ya.
So this is a person not medically qualified putting needles straight into people's veins. Certainly not on. She should be shut down.
Well, doctors have told Maria she's dangerously ill after the treatment.
So are you blaming me, young man?
She should be stopped before there is a tragedy.
Maria Worth is already living a tragedy, dying of breast cancer, and so desperate she tried this secret treatment. Injections from natural therapist Jill Newlands, who runs a clinic underneath her house. A clinic she wants to keep quiet.
Flying under the radar because we haven't announced it out there. We haven't told the world. It's very secretive.
Here I am going up there for treatment to save my life, and now I'm going to lose my life.
After 4 of Jill's treatments, Maria ended up in hospital with life-threatening blood clots.
I'm worried that somebody else is going to turn out exactly like me, or even worse.
I mean, you'd expect to see it somewhere in Mexico, certainly not here in Queensland. It really is quite sad to see this sort of healthcare going along in our backyards.
Loretta Marin is another breast cancer victim. She's also a scientist and a member of Skeptics Australia. We flew Loretta to Mackay to visit Jill Newlands' garage clinic with a hidden camera. Loretta knows how desperate sufferers are.
You'll do anything, try anything, pay anything, if it helps you get better.
Oh, look, Loretta, I wouldn't be going to any hospital and having chemotherapy, that's for sure.
Some of the things that she said, as a cancer patient myself, I'd be dead now if I'd listened to her.
Those are the 2 bottles.
Yeah.
What you do is you take 1 drop of the chloride, and you take 5 drops of this one. You put them in a glass, you wait 3 minutes, and they smell something disgusting.
It's called Miracle Mineral Supplement, or MMS, sold on the internet for $37. Jill Newlands is charging $2,000 to inject it through an IV drip hanging from an old coat hanger nailed to her garage roof.
People are drinking it because they cannot get the opportunity to do this, and a lot don't know it's happening. If they knew it, they'd be here like a shot.
Well, it looks like she's mixing a bit of bleach with a bit of lemon juice and feeding several drops intravenously into some very sick people, making claims that are scientifically beyond belief.
This is a little thing underneath your skin. It's like a little square metal piece, and then in the centre is a rubber ring. Okay, so put it in the centre. You ready, my friend? Yep.
Mrs. Newlands told Loretta the best way to absorb MMS is through a portacath, a device surgically implanted under the skin that feeds directly into a vein. Doctors use it for chemotherapy in hospital, but here Mrs. Newlands mixes up the potion on what looks like an old baby's change table.
So now she needs 90 drops of citric acid.
90?
Yeah, it's 1 to 5.
There was no autoclaving equipment there to clean it. She was barefoot. There was the wildlife running around the walls.
Would you put that in boiling water or something to
What?
sterilise it? The measuring cup?
Loretta, I can assure you things are very sterile around here.
She actually put a rubber glove on, and then she took it off and she put in needles with it. It was really a very sad situation, and certainly people could get infection from that.
This is my portacath, yes. That's the one that the doctors removed a couple of days ago.
Remember Maria? Jill Newlands treated her and Maria ended up in emergency with blood clots, where she says medical staff was stunned by what Mrs. Newlands is doing.
Yes, they were shocked to think that anyone could just go and do that. Touch a portacath that's not trained to do it.
She has blood clots.
I've heard all that.
She's dangerously ill.
If you would like to sit here and
so
talk to me...
you don't accept any responsibility for what happened to her?
Did you hear what I said? I'm quite happy to sit and talk to you if you want to get the full story.
So we turned off our camera and listened while Mrs. Newlands told us there was a pre-existing problem with Maria's portacath. But this letter from Maria's doctor says the Portacath was working perfectly, right up until Jill Newlands treated her. Maria's doctors say the most likely cause of the blood clots is this controversial treatment.
These
But
people
you
here
don't know
want
what you're
choices.
doing, do you?
Oh, that's your opinion, okay?
Well, show me the qualifications. Have you got qualifications to do
Listen,
this?
I've got qualifications, yes, but it's got nothing
To
to do
administer
with you.
Portacaths, to
It's got
administer
nothing
IV
to do with-
injections.
People have choices. Sadly, they have choices.
You know, this sounds very much like quackery to me.
Queensland's AMA President, Dr Chris Davis.
It is really of enormous concern that these people are being exposed to great risk with probably zero benefit and, of course, probably great cost as well.
How can you possibly think that this is an acceptable environment to be injecting people with anything?
Well, do you think I could go up to the hospital, Chris? Do you think they'd take me up at the hospital?
Well, of course they wouldn't, but
Of course they wouldn't.
you're doing this here in your backyard, in your garage.
Yes, it's not a garage, Chris. It's under the house, okay?
What would you like to see happen?
Put behind bars.
Quite literally, I think she should be thrown in jail.
Throw away the keys and stop her from doing what she's doing.
And following our investigation, police and officers from Queensland's Health Quality and Complaints Commission raided Jill Newlands' clinic, seizing medical equipment and supplies of a restricted drug.